The meeting focused on three major issues: the management of quarantine facilities, imported vaccines and vaccines production, and the scenario where there are 30,000 people infected with COVID-19 in Vietnam. Last week, more than 16,600 people entered Vietnam from Laos, China and Cambodia, of which 483 illegally has entered the country. Deputy Prime Minister Vũ Đức Đam said that severe punishments must be applied, including the prosecution of people involved in illegal immigration.
All illegal entrants must be severely punished. We can control these problems through visa issuance. Now the issuance of visas must be approved by not only diplomatic agencies and police, but also the Ministry of Health and the Ministry of Defense in order to make sure that people are entering Vietnam for economic developments and that there are sufficient facilities for quarantine.
Deputy Prime Minister also requested the Ministry of Health, the Ministry of Defense and the Ministry of Public Security to review all military and civil isolating facilities and report before May the 30th.
The government has discussed and agreed that people need to protect themselves and must make sure they wear masks. I request all the provincial steering committees to issue fines on anyone who doesn't wear a mask in public places.
Deputy Prime Minister Vũ Đức Đam emphasized that vaccines are the solution to the prevention of the COVID-19 pandemic, so the Ministry of Health needs to find different sources of vaccines for people to achieve the highest vaccine coverage and accelerate the progress of Made in Vietnam vaccine research and production. Also at the meeting, the Ministry of Health informed people about a Vietnamese hotel worker who tested positive for COVID-19 after making contact with 11 quarantine visitors from India, among which 4 had tested positive. 5 patients were now treated at the National Hospital of Tropical Diseases. 7 other experts and 1 Vietnamese are being quarantined and monitored at the hotel.